is can certainly overcome. Cancer for me is can certainly overcome. Because my doctor, when I visited him the first time, told me breast cancer is curable. And also for all the breast cancer patients, they get what I call a processing window. Now this processing window is the time between your mammogram biopsy and the time the results come. So when you say about how can you be resilient, there is a very simple 4-step method which I think helped me. I have named it for everybody. It would be easy to remember saying the 2 p.m. method. Now, when you know that you are being diagnosed with cancer, figure out your purpose. You are scared of losing your life. Means there is something you want to see out through in your life. For me, it was raising my daughter, seeing her milestones. So that for me was the definition of my purpose. I'm here, I'm going to see her graduation, marriage, everything. So I manifested that purpose. I manifested life after cancer. Then live your passion. I love my work. And doctor knows I work throughout my chemotherapy, my surgery. There are ups and downs. I also had a accident where I was bedridden for 2 or 3 months, and every patient goes through tough times. But apart from that, I was thankful to my managers and an organization that supported me throughout. But my work kept me going. So that was my passion. And the last and the most important thing, which people feel is very overrated, but I think it's the most important of them all, is meditation. It gives you the processing time.
There are a lot of myths about breast cancer. So one of these myths will be dispelled by these folks. They will feel more confident of undergoing the treatment, surgery. Not all patients require mastectomy. Women are ultimately afraid of physical deformity. So not all patients require mastectomy. Many may not require some may not require chemotherapy.
And the first thing I always tell my patients also is that if you are going to be there, only then you are going to be there to actually look after your family for a longer time.
But time is the best healer. And sometimes you don't accept in the first few days. It takes time. They may accept in the first month. In the treatment they may accept. And then come down to the situation. And then, the progress starts.
You have to raise awareness. You have to make sure that there is better delivery of care. It is available where it matters. Like Sir spoke of a woman in a rural area, if she has no access to a physician, even if they have conducted the breast exam, even if there are treatment options available, and believe me, there are about 22 schemes that the government runs today, specifically for cancer care.
When we are talking of awareness, we need not only make the women of our society aware, we need to make the men of our society also aware.
It's a very overwhelming journey for caregivers in terms of the fact that someone close to them has been diagnosed and they require a lot of energy, attention, emotion.
From the caregiver's point of view, I think they are so much involved in the patient's journey, in taking care of the patient's health, appointments, bringing them to the hospital, giving them medicines on time, looking up, but more importantly, their emotional health as well. It's very important to support them emotionally at that point of time.
There's this person by name Siddhartha Mukherjee who writes this book by name The Emperor of All Maladies. Of course, that's cancer. And he talks about the journey of how Zydus spoke about his journey of conquering the disease from chemotherapeutic agents to targeted therapies, footprints in the videos we saw before. So that I think in a very simple language, he discusses how the journey of the crusade to cancel cancer over the past many decades or centuries unfolded.
Life is so unfair and all the rest of it. So how do you see a patient through? Because until you get to the stage of determination, if you don't have that mental strength, that's the battle lost, right?
Most of the breast cancer patients are above age of 50. And it peaks at the age of 75.
As Dr. Raina pointed out, as age increases, the chances of developing malignancy are higher. In younger women, the chances that you are going to have benign lesions are higher. And but you need to be aware of the changes occurring in your own breasts by doing the breast self-exam, is what this campaign tries to send out that message.
And how do we as oncologists tackle it? So there is no other way than our counseling.
Often people think access and affordability are interchangeable. If you make something cheaper, it will become more accessible. That's not true. Many a times, even affordable options are not available to patients simply because of access issues or awareness issues.
So E plus R equal to O. So the event in your life, E is the event. Here the event we are talking about is diagnosis as a breast cancer patient. The reaction to that event is what determines your outcome. There are two things that need to be taken care of in your reaction. First is the acceptance. Because the sooner you accept, the bit faster you get things going and the action steps are faster. Like I remember 2 days into my diagnosis is when my chemo board surgery got scheduled on Women's Day, 8th March. So that is how things move faster because of the doctors and the team you have. Because you have accepted and you are asking them what are the next action steps. You are asking that question to the right people. The second reaction that you need is the determination. As I said, can certainly overcome. You need to have that determination to see this through. And when you have that determination, you have the biggest ally by your side. That is your mental strength, your mind.
So the Ciba-Geigy chemical company used to make this Vinaca and Cibaca toothpaste. And the same company also prepares aniline dyes which color our clothes. The Toms River Township was there in the US, near New Jersey, and above the township you had the Ciba-Geigy chemical company producing these aniline dyes. Aniline per se does not harm us, but the byproducts are extremely toxic, both liquid and gaseous, and constantly causing air pollution, water pollution and land pollution of the Toms River Township. So much so, it became a cancer cluster. And oncologists like all of us working in the US, in the Atlantic City, in New York, Philadelphia, found more and more patients of cancer coming only from the Toms River Township. For almost 30 years this continued. Salvation happened only when the Ciba-Geigy chemical company was permanently shut down. That's not an easy job at all. We have not yet been able to shut down the tobacco industry.
Easiest example is one such initiative. And awareness is not limited just to, like was very rightly said, to women alone. Unless the whole ecosystem is aware, no disease can be defeated.